So you're going to benefit from this content if you are a nurse or an aspiring nurse from Nigeria that wants to practice in the UK. Yeah. So I started my journey as a Nigerian nurse. I schooled and practiced in Nigeria for several years before so I'm a dual registered nurse. And I can tell you for free that there is a big margin, like the difference between the nursing back home in Nigeria and the nursing here in the UK is wide. The onboarding process alone was tough. There is lots of learning and adjustment to be made. I'm going to list the certain things that is quite different from the way we do it in Nigeria and how it's done here in the UK, and expatiate on some of those things that we already do, but it's taking more serious here. Number one of those things, documentation. The truth is, we literally overlook and underrate documentation back home. You just write a few short lines by the end of the shift. So you want to practice abroad, never play with your documentation. That's a lifesaver. Another thing that is a very big deal here is skills and competencies. Trainings, now what I've literally lost count of how many trainings I've attended, because to them your certificate of being a nurse or your PIN does not mean you're competent to give that care. So what this means is, if you're a new trained nurse here or you're from Africa, before they can allow you to perform unassisted, they have to actually ensure you go through certain trainings. Then you go through the competency process where you are being assessed. Then the final stage is sign off of competency. Like back home, I used to set cardinal lines, like, but right here, just because you're a nurse does not give you the right to set a line. You need to go through a special training course, then do a competency, be signed off to do it. Then medications, as a nurse, giving medication, you need to do medication training. Moving and handling, you need to have trainings for all of those. The third thing that is a very big deal here as compared to Nigerian nursing, or some things we do back home that I think it's normal, you could literally be safeguarded for doing those things here. So always ask questions. You're not unsure, don't say, oh, this is how we do it in Nigeria. You'll be safeguarded. The way you do your moving and handling, the way you care for your patients, you could be safeguarded if not done the right way here. Also, the use of social media as a nurse is highly regulated. You need to be careful of the stuff you post online, the comments you make, and your reactions. Because if a whim is gotten and someone, a member of the public or a colleague, reports you to the NMC, you could actually lose your PIN for that. So for nurses that are content creators or aspiring content creators, please do not get carried away with content. You know the guidelines, they will tell you what it is. Do not go beyond your boundaries because you're trying to create content as a nurse. Your PIN is at risk. Another thing is consent. They don't play with consent. You know, back home we are so used to, oh, time for your medication, bring your hand or it's going to be IM. Here, you need to ask the person, hi, so and so, is it okay to do your medication now? Because they can refuse. Some will tell you point blank, I don't want it. Then you just don't say okay and you go. You need to try to ask the patient why they are refusing. If it's something you can adjust, you help them adjust it or you escalate. And if it's like, oh, I think I want to finish my movie, or because I think I'm reacting to one of the meds or something. If it's like the movie, you can give them a little bit of time to finish that movie. Just ensure you go back to document on their paperwork that so and so said they wanted to finish their movie before having the medication. Then if it's a side effect to a particular drug that they are complaining about, you escalate to the GP and say, okay, so and so is complaining about a side effect. Can we get another alternative? Then even for the patients that are unconscious, you still need to tell them what you're about to do, even though they cannot respond to you, because it must have been stated in their care plan that they are not conscious, but whatever we do is in their best interest, and we still try to involve them in the process of care. So you'll be like, oh, hi John, it's me, so person, I'm here to do your medication now. Then you go ahead. Never assume. Don't make that mistake of assuming that since you're doing this thing in the best interest of the person, that's the consent you need. Never assume. I've seen people trying to do things to help a patient or a relative, but at the end of the day, they get sued because the patient said, my consent was not sought. before this was done, even though that was done to save their lives. I think finally for today, let's talk care plans and risk assessment. When we did nursing back home, I knew about care plans in school and we did it in council. Honestly, throughout my practice, I think I've only done 1 or 2 care plans when needed. Then the one I was actually very unfamiliar with was the risk assessment. We don't do risk assessment back home. We only do the care plans. So on getting here, each patient or resident you're looking after must have a comprehensive, detailed care plan. So for example, if it is oral care you're delivering to that person, there has to be a detailed care plan and risk assessment for oral care, meaning in your care plan you must have asked the patient or the resident, how do you want your care to be done? You must make it so simplified that a layman or a carer could go through your care plan and deliver the care. So the care plan is like a guide by guide manual to deliver your care to the person. Then the risk assessment is what risks can occur during oral care. Okay, maybe bleeding gums when you brush too hard, or when you use suction machine. If it's too much of a high pressure, that can cause trauma too. So risk assessment and care plans, if not done and an issue comes up, you could entirely lose your pain for not doing risk assessment and care plans. And it has to be updated regularly. Hi, so this brings us to the end of this session. Please, if you have any other questions or any clarification, kindly leave me a message in the comment section. And please, if you've not subscribed, this is the right time to do it. Please subscribe and turn on your notification bell. See you next time. Bye.